My role here at Good Samaritan is really overseeing a lot of the non-nursing clinical departments. The largest area of responsibility is the cardiovascular service line, but I also work very closely with our pulmonary services, our inpatient pharmacy, and our rehab therapies. I get to participate in a lot of project management, especially in our disease-specific programs like heart failure and stroke, and lead teams of clinicians to improve the quality of the care that we provide. How did I meet Erin Velazquez? Well, funny story. I met her when she was 13 years old and she was dating my younger brother. But I'm sure you want to know how I met her professionally. When I took over the cardiovascular service line here at WellSpan Good Samaritan Hospital in 2013, joining the American Heart Association board seemed like a really natural fit. And I've had the opportunity to work with Erin for several years in that capacity.
I met Steph many years ago because her brother was my first boyfriend in middle school. So that's the first time I ever met Steph. But the professional answer is I met Steph about a little bit over 8 years ago through my position here at the American Heart Association, where Steph is a volunteer. Steph is involved with a lot of our quality improvement programs through the American Heart Association here at WellSpan called Get With The Guidelines, where they follow some of the American Heart Association recommendations for quality of care for both stroke and heart failure. We also collaborate on many of the AHA events, our Heart Walk, our Heart Ball. Steph will also be the Heart Walk chair for 2020, so we'll be working really closely on that. And she also has been our past board president and our past board chair. So I rely heavily on Steph as a community member and a professional to really be an ambassador for my organization in the community and within the hospital setting. Oh my gosh, smart as a whip, like super smart. You won't find anybody who really knows her job and is truly an expert in her job. So smart, tenacious, she always gets the job done, and I would say reliable. She always does what she says she's going to do, and she does it well. I nominated Steph because she has been a true leader for our organization with the American Heart Association, but also within the hospital setting and the hospital structure. In the time that I've known Steph, I've watched her progress through the ranks here at the hospital, starting in PT and taking over the cardiovascular service line, and now in her current position. So it's just been really cool to work with her and see her grow here, but also work with her in her role as both a board chair and a board president with the American Heart Association, and really see her advocate for our cause as well.
It's really an honor to be nominated to the Lebanon County Women's Hall of Fame. I'm humbled by this experience and really appreciate the ability to be so involved in the community. I was raised by parents who were both very active. My mom was in the Junior Women's Club and on the board at Oakview. My dad was active with the Lebanon Lions Club for decades, and they really instilled in me the need to give back and get involved. And there are lots of opportunities here in Lebanon County to do that.